Tuesday night student chat. We do these live chats regularly with students, and we're happy to do so. It's an opportunity for us to get to know you a little bit better, talk about what's important to you, what you're learning in class, and to introduce you to some of our friends in the cannabis industry. We're happy to have so many smart friends, and that makes us smarter. And tonight, we're particularly happy to have Nurse Olga Hall back on. Nurse Hall, good to have you on. Nurse Hall is from Baltimore, Maryland, or currently from Baltimore, Maryland. You can find her online on her Instagram account, The Cannabis Nurse. I believe you were a more traditional, like family practitioner type nurse, and now you say, hey, I'm a holistic nurse now, and certainly a very outspoken, speaking truth to power, advocate, educator, lover of our favorite plants. So welcome. Nice to have you on.
Thank you. Oh, it's always lovely to be here. I love it.
Tell us a little bit more about you, because I gave you kind of short introduction, but I know you've been doing this for a minute. And so tell us, you bring a lot of experience to the table.
Well, I've been a nurse for like 20, about 24 years. And I've been a nurse practitioner for about 2 years.
Hmm.
I got into the cannabis space. I think we all, or at least I did. I won't say all. I won't speak for everybody. I'll speak for myself. I used to smoke cannabis as a teenager. It was great. We used to love it. And then I got a little bit older, got married. There's so much stigma around cannabis. I just kind of gave it up. My husband at the time was in the military. And then I got divorced, and I was going through this ridiculous divorce back in 2013. And my adult son came to me at that time and was like, um, you know, I see that you're having a lot of pain, you're having a lot of issues, you're having a lot of anxiety. He was like, you should smoke some weed. And I was like, I can't believe, I was I can't believe you would bring that to me. I'm a nurse. And he was like, whatever. I remember because I've had him since I was a teenager. He was like, no, I remember you used to smoke. Don't do that. So so I did start smoking again, and I was overwhelmed by how well it worked for pain management and
Hmm.
for sleep.
Hmm.
So then I started looking up. This was before the medical cannabis program came around in Maryland. I started looking up why it worked so well because it didn't make any sense to me,
Hmm.
right? The things that
Right.
you were told, from the media about weed, and then the things that the way that it actually works don't jive, right?
Right.
So we had to start doing some research. I was shocked at how much actual research there is out there. There's quite a
Right.
bit of research. Not nearly enough, but there is enough for you to be able to say clearly cannabis works as medication.
Hmm.
So um, once I got there, then I just kind of ran with it, especially in this area. Baltimore is heavy on, we're actually the overdose capital of the United States right now.
Hmm.
Um, and there's a huge influx of synthetic opioids being pushed in Baltimore. I
Hmm.
always feel like Baltimore and Philadelphia are like the testing grounds for these crazy substances. Um, we need more options
Right.
than just methadone and Suboxone, because those are just more synthetic opioids. So we need something else besides that can give people the kind of pain management or anxiety management, PTSD management that they need, because it's rough out here. So
Hmm.
I don't feel like there's a way to be a nurse practitioner in this area without at least knowing a little bit about cannabis and how it works and how good it could work for your patients. It's very important.
Oh, I can't agree more. And as you know, not everybody in the healthcare profession feels that way. Not everybody had, or many people had little to no exposure in medical school. Let me ask you, when you were getting certified, you were doing all your nursing training, what was the tone around cannabis then? Do you remember it even being mentioned? Or was it only mentioned in kind of very negative light?
So my first nursing degree back in like 2000, yes, that it's just it's Schedule 1, and that's
Hmm.
how they teach it. They just teach that it's Schedule 1 medication. You don't use it, you stay away from it, just like you would, PCP or heroin.
Right.
Stay away from it. It has no uh, medical value, which is interesting to me because they they still use heroin, right? Heroin is just
Hmm.
morphine. So, and morphine is not Schedule One, but cannabis is. That doesn't make any sense, but we won't get into that. Um, but yeah, that I actually forgot where my train of thought was going on that. But yeah.
No, you're right there with me. And we were talking about getting exposed and getting training
Mm,
and what was
mm.
the tone. So you said the first time. So how about the second time? Was it any different?
They back in 2022 when I graduated from nurse NP school, a lot more. They don't really teach you anything. They just
Hmm.
kind of teach you that people use it as medicine. It has medical value,
Hmm.
but that's all they teach you.
Okay.
They don't teach
Okay.
you
Right.
any of the details about specific cannabinoids. And I know that the doctors I work with get almost no education, and they have
Right.
to. I had one really great example at work where I do substance use consultations at the hospital. So I was called in to do a consultation for a patient. They said she was a cannabis addict. So I'm always curious when they say this because I'm like, it's going to be some bull because
Right.
it always is. How can you label somebody an addict when you have no understanding of the plant to begin with? So I go to talk to the patient, and they were like, the doctors are telling me she uses 4 or 5 gummies every day. That's a lot of gummies. And I'm like, well, I mean, is it? Does it really? Do you know what milligram? They're 40 milligram, the doctor was telling me. She uses 4 to 5 40 milligram gummies a day. That seems like an addiction. So then I went to talk to the patient, and the patient says to me, I can't feel it. If I take 2 gummies, I don't feel anything. If I
Right.
take 4 gummies, then I feel it. I take
Hmm.
5 gummies, I can sleep really good. I'm like, okay. So then I had to go back down to this group of doctors and explain to them how the CYP 450 enzymes in the liver work, and that some people's liver enzymes are very robust when it comes to processing THC, and other people's do it very slowly. So it will leave their system very slowly. So she's one of the people that it moves very quickly through her system.
Hmm.
And they were just standing there like, oh my God, that's amazing. That's fast. I'm like, yeah, read a book.
Thank you. And because it's so needed, right? And they could hear it from 10, 12, or more patients, but to hear it from somebody else who's also working in the space, who's also a healthcare professional, is critical. So I imagine you have opportunities for that kind of conversation regularly. Do you have a elevator speech or something that's concise that, like, you might not get somebody for as much time as you would like to engage them on the topic? What's your do you have an elevator speech that you try to help people understand just a little bit?
um, in my field, like at least in the substance use space, my first thing is because the hospitals are cannabis. So my way to kind of get into the conversation, because they're always bringing up, oh, we can try this or we can try this, but if it's cocaine or PCP, we don't have a medication to reverse the effects of that or
Hmm.
to help people with withdrawal like they do opiates. You can give
Right.
Narcan, you can give methadone. They don't really have much for stimulants. So I will I that's what I come in with the RSO, and I'm like, we could use concentrated cannabis oil. And then I have a little notepad of
Hmm.
uh, printed out materials just in case, because the doctors are always looking at me like I've lost my mind. So then I pull out my printed materials, and I'm like, RSO really can help cover a lot of these symptoms. You won't have to worry about the respiratory depression. You don't have to worry about making withdrawal worse. And if they use on top of it, you don't have to worry about overdose.
Right. Right.
And that is like my hook, my catch to get the doctors on board.
Excellent. And it is so critical, right, that those opportunities to learn and since they didn't get exposure, it's interesting to me. You're working in substance use with people with substance use disorders. Some people call when people are sober, except for cannabis, that the California sober or saying, right? That somebody's California sober, so they just smoke weed, but they're staying off of harder drugs. I was following a discussion on Reddit the other day, and people were like, "That's not sobriety. That's just being a weed head." And I imagine you hear it too. What would you say to somebody who says, "Look, that's not true sobriety. They're just leaning on. They just got a different crutch."
So I hear this a lot.
Hmm.
I start out with, there's nothing I can do about your pre-existing biases towards addicts. And that's how I always start,
Hmm.
because it usually shuts them up. They usually stop there. There's nothing I can do about that. However, addiction changes the chemical makeup of your brain. So once you start using, you've already changed the chemical makeup of your brain. Once you get addicted and continue using, you're changing it further. There's a good chance you're going to need medication after that to maintain the illness that you now have, just like you would for any other illness. And um, total sobriety should never be the ultimate goal. And it's weird to me that people keep pushing total sobriety. We don't ask that y'all be totally sober all the time.
Right.
So why are you forcing? Nobody wants to be, they don't want to be sober all the time. I get that. I get it's a
Hmm.
messy world, but if we can, it's not, the problem isn't that people use drugs, it's what the drugs does to their body and their life, right?
Hmm.
Cannabis does not have those effects. So honestly, and I've said this to people, if you want to call someone a cannabis addict, you can do that. There's not,
Hmm.
whatever, do you can call them that, but that doesn't it, the person themselves shouldn't feel bad about that, because if you were on methadone and staying off of opiates, they would call you clean.
Hmm.
If you're on Suboxone and you were staying off of opiates, they would call you clean. So if you're on cannabis and you're staying off of the thing you were addicted to, then you're clean.
Right.
That's it. That's I will die on that hill.
No, and thank you, because it once again it's so needed. The gosh, there's so much to go with there. The let's talk a little bit more about. You mentioned cannabis use disorder, and that somebody said, "Well, oh, she's obviously this, or this person is obviously addicted." Um,
Mhm.
how frequently is it that you encounter patients who say, "Look, I'm using too much cannabis. I am concerned. I don't have control over my intake, and I feel like it's not healthy for me." Is it? Do you encounter patients like that, and what's that conversation like?
I do. And I almost 100% of the time can diagnose those people with an outside mental health condition.
Okay.
Generally, it's not the, I think people keep associating with weed with the move to depression or the move
Hmm.
to anxiety. Oh, it's because you're taking in so much. I feel like people start using those things heavily and overusing them because they already have the underlying condition.
Right.
So we have to treat your depression. That's
Hmm.
we got to treat your severe anxiety. We got to treat the PTSD, and that's one that I think a lot of people miss, is that people don't think that they've been traumatized, even when the most horrific and traumatic things have happened to them.
Right.
And that is something that obviously needs to be addressed, because you can abuse anything.
And I'm glad you brought up the word trauma. As a nurse, I know you're, and we've talked about, I know you're very aware of trauma informed care, the importance of being really keyed into paying attention to the fact that, you know, at least 70% of the American public has, according to research, has experienced trauma. It's very common, and it's very serious. It impacts our brain and the way we see the world and the way we interact with other people. Could you talk a little bit about that trauma informed perspective, and how um, it helps you serve your patients better, and how it could benefit the industry if we knew more about it?
I I am a person that believes that capitalism is the root of all evil. So that I think is the primary problem with everything, is that a lot of our trauma revolves around the capitalistic society the way it is. I think 2020 really wrecked a lot of people,
Hmm.
and they've just been in poor mental health since then. So we're dealing with a lot more trauma and trauma related issues. People that never had anxiety before now having panic attacks and things like that. It's trauma.
Hmm.
Uh, Understanding that is, I wish that we could. What I wish I could do is work with the state to get a program put together to kind of funnel some of these patients not just to treatment, but also to not just to medical treatment, but also to mental health treatment.
Hmm.
We need more centers of for people to go and talk to somebody. More people to a lot of these people feel like they're alone. They feel like they're
Right.
on their own. Um, I the dispensaries have, at least in this state, I feel like dispensaries have a unique position in trying to catch some of these people, because a lot of people going in the dispensary are sick. They have medical trauma. They have,
Mhm.
you know, their own history of trauma. This is a great place to start trying to catch some of these patients. Maybe put together a class, maybe put together a support group or something based around cannabis, where you can use cannabis mindfully while, you know, participating in groups and things like that. If we're able to add cannabis to therapy, I think that we'll get a lot further. And also psilocybin.
Oh, yeah, and let's come back to that. Don't let me forget. You know, along with the bias against, or maybe the not bias against as much as ignorance of trauma informed, or people who've experienced trauma, um, we've recognized there's also a bias against or preconceived notions about people who are neurodivergent. And and I know, especially when it comes to cannabis, people might think, oh, well, you could probably share with me the bias statements you hear, but I've heard, hey, well, we don't want to further complicate somebody's life who's already neurodivergent. That's unnecessary. Um, do you hear anything like that, or similar statements that are just maybe not well informed, and you'd like to engage that person some more?
Very much so. That because people often are like, I don't understand how you could use how does cannabis help autism? I'm like,
Uh-huh.
you can't be serious. Um, I'm also of the belief that a lot of these disease processes, including severe anxiety, autism, ADHD, yes, of course, they have other physiological causes, but one of the root physiological causes of all of these is low endocannabinoids.
Mm-hmm.
Um, so replacing endocannabinoids for most of the time is helpful, um, as well as depending on what issue the patient is having, you can tailor the treatment to,
Mm-hmm.
you know, specifically for what they need. So you're not getting any rebound effect or anything like that.
And so, and to be clear, we're not talking about curing someone of being autistic, but symptom management, right? So if I can help reduce, for example, we've worked with medical professional, worked with adult patient with autism who their family was very excited that all of a sudden with this patient, his kind of OCD type tendencies of
Right.
messing with something, or being socially anxious, or um, food intake, food control, portion control issues were really severely mitigated and calmed by just a little bit of cannabis. And it allowed this young man to be able to sit in a room when other people, even strangers, were in the room. And they're like, before he would have been in his room or in the garage, like staying the hell away from everybody else. And they're like, he can sit down and eat 2 pieces of pizza. And they said, normally he's going to eat the whole thing if we leave him to it. And it just, you know, he eats till he's sick. And I know everybody doesn't behave like that. But have you seen similar beneficial effects to
A
help
lot of
mitigate some
them.
symptoms?
I have more than a few kids
Mm-hmm.
that, God, there's these one to two children, they anoxic brain injury. So the little girl does not, it's a very unfortunate case. She doesn't really talk much. She can walk a little bit. She just started getting menstrual periods. So it's
Mm-hmm.
really a lot trying to manage her.
Right.
Um, but her before she was on cannabis, the mom was using pharmaceuticals that were just weren't doing any good, or
Mm-hmm.
she was getting ridiculous side effects. So we just added in whole plant CBD, nothing fancy, just whole plant CBD oil. And she sees it's like night and day.
Right.
The tremors stop. We've gotten rid of the Valium that she was using for her breakthrough seizures, and we're just using whole plant CBD. We're using CBD RSO.
Mm-hmm.
Um, it and that kind of shocked me how much better the CBD RSO worked. I know I've seen the videos, and we've all seen the videos online of like somebody's child or somebody, you know, having a seizure. At least I've seen a couple of videos online. I'd never seen it in person.
Mm-hmm.
The Valium that this little girl had, it took 7 minutes to stop the seizure. The whole plant CBD oil, it took 1.5 minutes. I was floored. I was
Wow.
floored. That's a lot of time
Mm-hmm.
that we can, especially somebody that already has a brain injury, they keep seizing. The longer they seize, the more risk they're at of having
Right.
more brain injuries. So it's amazing. That's to be able to cut it down by like 6 minutes. That's insane. So yeah, we were really over the moon about that, and I love seeing things like that.
Oh, absolutely. And I've kind of dominated the conversation or the questions to you. So I want to turn to our students in the room and see what kind of questions might you all have for Nurse Hall.
So I actually I watched another video that you did with moms that smoke pot,
Oh
and
yeah.
who brought up a very interesting subject. Because I used to smoke before I worked out. So is weed, does it help with whatever mood that you're in? So if you're chilling, weed will help you chill. Or on the other spectrum, like when I used to go work out, it used to really like decrease the the pain that I would get from actually working out. Can you expound on that?
Isn't that the best? Um,
It
I
is.
see cannabis is a recovery drug as much as it is anything. So, um, when you are when you go to the gym, you're putting out all this energy. You have all, your muscles are expending all this energy. You're sore afterwards, right? When you smoke,
Yes.
especially if you smoke immediately after, all your endocannabinoids receptors are especially heightened because you just got done exercising. So it's a great time for you to smoke right then, get the fullest benefit of your medicine. Your blood is really going. That's just one of the best times to absolutely use cannabis if it works for you. I love a good sativa and then head to the gym and then a little bit more sativa afterwards, personally.
Same, same. And Stephen, I'm glad you brought that up because not everybody is aware, right? And just to be able to reduce inflammation, like it might not do. I don't know if it interacts with our lactic acid. Like we might be stuck with that. But as far as inflammation, that's one of the best. That's one of the things cannabis is best at. And inflammation, as we know, is tied to so many
Mm.
complicated conditions. Whether it's arthritis or uh, you name it, but things that are really painful and things that people live with daily in some cases,
Liver disease, heart disease, all inflammation.
right? And
Yeah,
so, yeah, if you can keep the inflammation down in your body, that's quite a gift to your body.
amen.
Um,
I do say to people though, a lot of patients, if you're not using CBD, you should throw a little CBD in there
mhm.
before you go to the gym as well. You'll get even better. CBD kind of boosts your anti-inflammatory properties. So it'll give you even more relief once you get done.
And I'm glad you said that. So often the stuff that's on the shelf, our cultivars, our strains, so to speak, are on the shelf are really CBD poor. We've bred CBD almost out of the plant, and people who've taken our class are recognized it. And because of the paraquat spring in California in the '80s, so much of that growing came inside, and then the push was to genetically push for higher THC, higher THC. Nobody
Mhm.
was talking about CBD. But in nature, it's a lot closer to a one-to-one relationship, or at least there's higher CBD content. And sometimes we have to kind of search it out. And sometimes those plants have lower THC numbers. And as we know, a lot of people are just shopping for high THC numbers because they think that's what you have to do. Um, Nurse Hall, do you hear that from patients? Do you have to kind of help recalibrate people's expectations and say, hey, no, 12% THC is not a bad thing if you got CBG, CBD, and some other cannabinoids in there?
I just recently actually had done a post about this where I found I was in Vegas.
Mhm.
And we went out to Planet, I can't remember the
Is it
planet.
Planet 13, I think?
Planet 13, that's the
Hmm.
one. We went there. It was huge and they had a really great selection.
Hmm.
Uh, but we got like a couple of ounces of flour while we are out there, and nothing was over 20%. It smoked so good. And I said, is it just because I'm out of the state? Is that why everything smokes so good? It smokes so much better than in Maryland. It's got to be because we're on vacation. But then we were looking over the terpene the content and the cannabinoid content on there.
Mhm.
They were out of this world. They had terpene percentages that were like 6, 7, 10 times higher than I see here in Maryland. And then it had CBG, little bit of CBD, little bit of CBG, a little bit of CBC. That's amazing.
Mhm.
Yeah, I will smoke a 17% flower as long as it's got the terps and it's got the cannabinoids. Oh my goodness, you'll get so much better. I wish people knew that, because you're right. They do keep going just for the high THC. And then they come back to me and they're like, I'm not sleeping. It worked for the first week, but I don't understand why. Because your body got used to the THC and there's nothing else for it to work with. It's just
Absolutely. Yeah. And landrace strains, if we know not everything is labeled honestly, and sometimes here in Seattle, when the last time we were in a Super Bowl, all of a sudden you saw Marshawn Lynch strain everywhere in town. Well, people weren't growing Marshawn Lynch strain 8 months before to have it on the shelf in time for the Super Bowl. But a lot of Blue Dream all of a sudden overnight was relabeled Marshawn OG, right? And we know that happens. It's marketing. It's not supposed to happen. But although landrace strains can be mislabeled, we know they're out there. And so we encourage you all, if you haven't tried landrace strains, and we're talking Panama Red, Colombian Gold, Malawi, Durban Poison. Some of these are the OG, true OG, not OG like we talk about OG Kush, but some of the original cultivars that existed in nature. And if you get a chance, smoke some of that stuff. Funny enough, I was in a cannabis store, Olga, and in this I don't know, older, he's my age, a little bit older than me. A guy came in and he looked around, he said, where's that brown weed? I said, what? He said, I'm looking for that good brown weed we used to smoke. And he said, none of this looks like it. I said, well, sir, and I said, this is what weed looks like when you're allowed to take care of it. You don't pack it in a brick and ship it, have to smuggle it in. I said, this is what it should look like. And he listened real patiently, and he let me finish. And he said, so you don't have any of that good brown weed? Because he wanted that old school feel. And he said, I've smoked this stuff. It just doesn't feel the same. And so some people who have been around a while might just want to have that taste, right? We know flavor and smell really locks in our brain. So another reason just to try something different, no hate on the strawberry surprise and daiquiri ice and all the little flavors, all the fancy flavors we got, but some of those original ones are worth a look. So
definitely.
let me ask Paul or RJ, y'all have any questions?
Yeah, I got a question. So is Washington State, is that one of the reasons why when you look at a package is so detailed as far as the ingredients and stuff?
Yeah, we're required. There's certain information that's required to be on a package, and it's real frustrating to producers because it makes their label bigger, and the bigger the label is, that can, kind of get in the way of people seeing through the package and that sort of thing, or hard to get on there. But yeah, there are certain requirements for things that have to be on there, and fortunately, terpenes are one of them. Cannabinoid ratio is another, and so, but not every state has that same requirement. We have that,
So now that things are getting rescheduled, do you think that might be an opportunity for have the states pick up to provide more information to the customers?
Oh, that's a good question. I don't know.
Okay.
No, I think the intended and unintended consequences of this rescheduling, which looks like it's going to go to Schedule 3, will be interesting to watch. Right? It'll be easier to do research. Y'all know for many years, the University of Mississippi had a stranglehold on being the monopoly source for any kind of studying of cannabis, and it was notoriously bad. Just it was beat up and not well taken care of. Dr. Sue Sisley, who's worked with veterans, said it was unusable. And then it was also, they would get it and it would come in with a message said, this plant may contain mold and other pathogens. She says, well, I'm not about to give, why would I give that to patients? Or they said it needs to be irradiated to protect the patient. She said, if you're growing good weed, that's not necessary. Now, they've opened that door up and more resources are available. But yeah, that's some of the garbage researchers have had to deal with.
Well, that's our government.
Yeah. Well, like they've said for a long time, you want to take the profit out of the illegal weed sales and get the government involved, right?
The 5 most dangerous words.
Pretty much.
Have Reagan said that? Yeah.
Yeah. What did Reagan say? I don't quote him much. I'm from the government and I'm here to help, right?
Right.
If
Anyway,
you learn more about those numbers and things on the back of the package, you can really titrate how you want to feel. And that's the beautiful part about it being on there as well.
That's a really good point. And a friend of mine used to say, "I'm gonna make a salad joint." I'm like, "What?" He said, "Why would I just use one type of green?" He said, "If you're making a good salad, you put a little bit of this in it, a little bit of that, and a little bit of that flavor." He said, "I want the benefits from several kind of cultivars," and not everybody thinks about that. Some people think they just have to find the one good strain or cultivar, and some people, they might find some benefit in mixing it up because, like you said, it's the dose and it's also what's in the mix. So
Like I personally, if I find a strain that's high in CBG, I will grab it because I like, with the morning nausea. So CBG is good for the GI issues, but strains that tend to have, at least here on the Maryland market, strains that have higher cannabinoid percentages have lower terpene percentages. They're just having a hard time growing. So sometimes I'll end up with, a couple different eighths because I want to titrate a feeling. So that's exactly what I do is I'll take a little, like a third of a gram from this eighth and a third of a gram from this eighth and maybe a third of a gram from this eighth for flavor and mix it all together. And then I'll get a nicely tasting blunt that, is going to help me sleep and make me not be nauseous in the morning, so just titrate a feeling.
Good call. I've really been enjoying your Instagram feed, and I in the introduction I said that you speak truth to power, but you really you don't mince words. I think I really appreciate your honesty, your straightforwardness, and the importance of education. I like what you're doing to educate the public is huge, and I know you got thousands of followers. Could you talk to us a little bit about, because education can be boring to some people. They're like, "Oh, I didn't like school," or I don't want to get nerdy on the subject. But you have a really nice approach that I think calls people in. What do you find people connect with? What is it? Is it certain types? Is for you? Is it approach? Is it topic? Is it timing? What seems to be reaching your audience?
Like you said, people do not really care about education, but at the same time, they want their medical conditions treated. So if I try to throw a little humor in there with it, then, sometimes maybe I can get some of my points across. Some of the major points, like, I want people to use RSO for chronic pain, or, how to navigate through the system in Maryland, our medical cannabis system. It's a mess. Metric is a mess. So trying to help people navigate through, get their medical cards, whatever needs to be done. I just try to do it with a little bit of humor, and people are receptive.
One method of consumption that I think is underrepresented often and certainly doesn't represent a huge section of sales percentage-wise is tinctures. And I know you've been very outspoken about your love of tinctures. Why? Why should I, if I don't, and I do use tinctures, but if I didn't, if you're talking to me as a patient, why should I even consider that?
Okay. I love a tincture because they are so versatile. Okay. They're fairly easy to make. So if you're just feeling lazy and you want to make a lazy tincture, all you have to do is decarb the flower and throw it in some alcohol and leave it there. That's it. If you want to be fancy, you can put it in the freezer and shake it every day. And then after about a week or 2 weeks, you will have yourself a nice potent tincture. But even if you get it at the store, I actually do prefer it oil-based tincture because there's a little more I can do with that. Alcohol-based tinctures, I'm speaking from personal experience, they don't go under your tongue. Okay. That's painful. So I prefer oil-based. The thing I love about tinctures is that you get like edible style effects from it without it actually having to go through the liver. So you actually get more of the medicine. it's longer acting. I don't like inhaling for the daytime. I think
Mhm.
that if you're sitting at home, great, and or you're going someplace where you can smoke, off and on throughout the day. But the best way for a person to medicate is just like any other pharmaceutical. You want to keep an even dose of the medication in your system all day. You don't want these highs and lows
Right.
like you do with smoking, right?
Mhm.
If you're treating a chronic illness. Tincture is going to give you 6, 7, sometimes 8 hours worth of coverage. So if you're leaving for work in the morning, put a few drops in, maybe at lunchtime, put in a few more drops, and you're covered for the day. If you hold it under the tongue for a minute or two, let that part absorb. The part that you hold under your tongue goes into your system within 15 minutes.
Mhm.
And then of course, after that, you'll swallow it. After you let some of it absorb, you swallow. So then you do still get the second pass through the liver. So you
Right.
get the first pass that goes directly into the system, and then the second pass from the part that you swallowed. So you get kind of like, you'll get your initial feeling from your tincture.
Mhm.
And maybe in about an hour, you'll notice that you're getting extra feeling from your tincture
Mhm.
because the part that you've swallowed has then kicked in. And at least for me, I sail all day on that, just with a nice level of medication in my system. And then when it comes down slowly. So you've got like an hour or two to go ahead and get more medication in your system if you need it.
Yeah, thank you for advocating for that. I'm with you on the alcohol tinctures. Too much, not pleasant, and I don't. Alcohol doesn't play a part of my life anymore, so I'm okay without that. But it makes a lot of sense, right? Because of the nerve endings, the blood vessels that are so concentrated right under the tongue. So we're talking sublingual or under the tongue, or buccal,
Mhm.
Buccal, I think. So right in the cheek. So some people will do that way, but just like you said, going directly into the bloodstream. I don't know if you had the opportunity to try these the ones that are water soluble.
I
They
think I
have they have some new ones here, and I've tried. Green Revolution was the brand here. If you're in Washington State, you will. Green Revolution makes a tincture that you put it under your tongue, and instead of that like oily or
Mhm.
glistenery kind of feeling, it disappeared. It
Mhm.
it being water based, it absorbed. It felt like it just went away. Like there was hardly anything to swallow, and it was fascinating. And the onset was faster, at least in my mind, than any tincture that I've tried. So if keep an eye out for those because it's quite exciting to me.
That sounds, I would love that without all the oily feel. That would be amazing. Um, a few other uses though for tinctures, because I carry a tincture on me. We had a patient come into the ER one time that was, he was in psychosis
Hmm.
from uh, he had taken too much THC and it was just
Hmm.
kind of out of his mind a little bit. They were giving him antipsychotics for like 2, 3 hours that were doing nothing and making it worse. And I got there and I stopped the antipsychotics and pulled out the CBD oil out of my purse and put the whole dropper full under this man's tongue. And within 30 minutes, he was ready to go home. So it's
Wow.
but also, if I'm at work and I start having a pain in my knee, pain in my
Hmm.
wrist, I just take the oil tincture and drop it right on that area and rub it in. If I don't have a topical on me, you can
Hmm.
use like a topical. You can make topicals out of it. You could also make medibles with the oil. So you could
Hmm.
put the oil then in anything. Like I have cooking oil that I just dumped the tincture into my olive oil bottle and shake it
Hmm.
up, and then you've got infused oil. It's that simple. So it's so versatile.
I'm glad you said that because some people don't realize, hey, if I just how cost effective it is to make your own edibles, to make your own tinctures, because you can take some weed that's good, clean weed, but kind of beat up looking. Maybe it's not the prettiest bud or the little popcorn buds that are a better deal,
Mhm.
and make your own edibles. Decarb that in the oven. You can, like you said, make the lazy oil version. So put that in some olive oil and let it sit and do its thing, and then everything can be medicated. Your salad, your pasta, anything you would normally put olive oil on or cook it in. The problem with cooking, of course, is the heat can degrade and kind of denature the cannabinoids. But if you're cooking low heat or cooking quick, that doesn't matter. So I'm glad. Thanks for stepping up for tincture tonight, because it's, we talk about sometimes it's like our grandmas would have known about tincture, because back when herbal medicine was more popular, like especially maybe grandmas before there were Walgreens, there were a lot of people making their own medicine. I mean, back in the day, before drugstores, the drugstore was what you had growing in the garden, right? Or the person who knew a lot about plants. They were the apothecaries.
We are definitely getting back to that. Patients are, I also see primary care patients, and they just don't want to be laden down with pharmaceuticals anymore.
Right.
I'm like, it's the perfect time for me. It's my time to shine, because I am so, if we have to use pharmaceuticals, obviously, like I'm not going to try to treat, high blood pressure with cannabis, right?
Mhm.
Like I'm not going to treat a stroke victim with cannabis. But if you're just telling me, oh, I have some, early stage arthritis, no, I'm not going to give you Motrin. I'm going to give you some
Right.
CBD oil and tell you start exercising every day. I want the holistic medicine to come back. So I'm very happy to see that.
Thank you for saying that. Like you said, Motrin, NSAID medicine, non-steroidal, anti-inflammatory drugs bring a risk. And I grew up, and the logic was, hey, take a couple Tylenol for that, take some aspirin for that, take some Motrin for that. But all those things have effect. It increases our risk of heart disease, of stroke. They're not without side effects that don't come with cannabis. Everything has a potential danger, misuse, right? But well, if you can avoid that other stuff, they got a lot of advertising money, but and it might help your headache, but sometimes there's another cost.
Definitely, definitely. And then the GI tract also.
Oh
I
yeah,
I
not even
take care
mentioned.
of the GI tract. So yeah, cannabis is much better.
For sure. Hey, Marianne, I didn't welcome you when you came in, but welcome. How you doing?
Good, thank you.
Where are you calling in from tonight?
Uh, from Massachusetts.
Oh, fantastic. Good to have you.
Yeah.
Do you have any questions for Nurse Olga?
Well, I just heard mention something about tinctures in the liver. And I've taken some really for the first time. Not really for the first time. Long, long time ago, I had some when I was going through menopause, and it was a great help. But I don't remember whether or not it was tinctures or something else, so forgive me. But recently, I picked up some from a place that at the Cape that is very well known for doing it and doing it right. And I got some for an immune booster, and it was two. It was meaning that was told me that it was a step up from just their regular standard. And I have to take a lab test for other kind of illness like every 2 months. And I've never had this result before. I had taken it for about a month, and this lab test came back and showed that there was an increase in some of the what you call it, fluid, or some of the chemicals or something in my
Some of the
liver.
markers? Okay.
Yeah, markers. Yeah. So I immediately stopped, and I'm going to take another one in the next 2 weeks. And I was wondering whether or not it was it's associated with what I was doing for the month.
Hmm.
Uh, whether or not, I know no one knows until I get the test and so forth. And anything could be. But just randomly, what do you think? That might be a possibility?
It's a possibility, especially if were you taking the tincture along with any other medications at the same time?
Just my regular medication and my vitamins that I take,
Okay.
the D and the zinc.
Was it a CBD or THC tincture?
No, just a regular
Oh,
herbal. Is
oh,
that the same thing as a CBD
I'm not
herbal?
sure that, because sometimes if it has CBD or THC in it and you
No, it
take it
didn't.
together with your pharmaceutical medications, it can absolutely cause a little congestion in the liver.
Okay, but it wasn't. It was not a CBD or
Oh.
THC.
Hmm.
Okay, I just lost your sound for a reason. I don't know. Is it me or you?
Uh-oh.
We can hear you fine. So
Yeah, we can still hear you.
Okay then. Okay. So you see it probably wasn't connected to,
I hope not. I would
I
think
hope
that
not
I would
either.
definitely ask them what exactly, the ingredient list for that tincture.
mhm.
There may be an herb in there that doesn't agree with you.
Yeah, yeah.
So
Okay.
definitely check.
Now the other thing tried for the first time a CBC and THC edible,
Mhm.
and never tried it before. And the first time I tried, it's candy, so I'm chewing candy and it's gone, right? Didn't feel anything. And then I said, well, next time maybe what I should do is just let it melt in my mouth. And then when I let it melt in my mouth, I felt more of the effect
Hmm,
of it, where it was one for calming and anxiety.
hmm.
So does it really make a difference in how you eat that edible, or it was just that's what happened to me?
That's interesting because usually it doesn't matter, but
Okay.
it's possible that maybe it absorbs some through your mouth, when you let it melt in there, that you
Hmm.
got some, absorption through your mucous membranes in your mouth, and maybe it just agreed with you a little bit better that way.
Okay. Okay. Because it was at a very well. Since I started first time, I made it extremely low, and it was called
Good.
elder. Is it from elderberry?
Hmm.
Yes,
And
that's
it speaks
great for
about how it's healthy for the immune system, which I'm
Mhm.
trying to build.
Wonderful for immunity. And it tastes
Okay. Okay.
Let me ask you,
Well,
Olga. I'm sorry. Go ahead, Marianne.
I didn't hear you.
Oh, go ahead. I'm sorry if I interrupted you.
No, you did not. I'm
Okay.
basically through.
Oh,
Okay. Well, I wanted to ask you, Olga. I've had people in my own family say, "Well, I can't take any cannabis because I have a doctor's appointment next week, and they're going to draw blood, and they'll see it in my system." And I think there's a thought from some people that well, when the doctor looks at my blood, he's going to see the little cannabis leaf, and it's going to look like, and if I don't know anything about blood, I get that it would just show up. Could you talk to us a little bit and dispel that myth? Because I know they could find it if they're testing for it, but if you're drawing somebody's blood and you're running kind of a regular tests for
mhm.
cholesterol or white blood cells or the iron in my blood, are you going to see that?
Absolutely not. The only way you
Okay.
would even see it was if you were very specifically testing for, cannabinoids and their metabolites. So that's it. Generally, it's usually urine. They don't even
Hmm.
test blood for, I mean, they can. I've
Right,
seen. And your primary care doctor is definitely not wasting any money
right.
doing drug testing that your insurance probably will not reimburse for because there's no reason for it. So
Have you heard that before? Have you heard similar fears from folks?
not that one specifically. We have a regional medical record here called Crisp Health
Hmm.
that every doctor in the area can see. And I always have to remind my cannabis patients to opt out of that because I don't think that all the providers that you see need to
Hmm.
know. You
Right,
can tell the ones that you want to know, but there's uh, too much stigma out there still for you to just tell every provider at the urgent care that can see your regional medical record, oh, you have a cannabis card. They don't all need to know that.
yeah, and I'm glad you brought that up because certainly it's a choice, and some people want to advocate and want all their providers to know, and they're like, caution to the wind. I don't care. Y'all need to know this. And other people are like, hey, I don't want that in my record. I don't want an insurance company. I don't want somebody else to look at that and make some snap decision about me. And so I'm glad. Thanks for urging caution or at least thoughtfulness about what you do share with your physician.
Thoughtfulness.
Good to know.
Because if you come into the ER, there's a good chance you're going to get stigmatized if you just like, I'm a cannabis patient. I've seen too many cannabis patients. They withhold the pain medication, or especially if it's a GI issue. I have actually in the hospital gone toe to toe with multiple doctors over not working patients up properly because they're like, well, they smoke weed, and I'm
Hmm.
like, that doesn't mean it's automatically hyperemesis. You absolutely still need to work this patient up.
Right,
Oh,
right.
I,
Yeah.
I I'm always like, if it's something, if you're going in with a breathing problem, yeah, you should probably let them know that, I smoke, this is going on. If you're going in for almost anything else, you're good. Use your best judgment about what
Right.
they do and don't need to know.
Thank you. And Paul, thanks for the information in the chat, particularly for links. If you're watching the video and you don't see the links, for a link to a resource where you can check about contraindications. So if you're already on pharmaceuticals, check how cannabis may interact with that medicine. Always important to ask or to be aware of that sort of thing. So thank you for that. And we're at time, Olga, and we didn't get to psilocybin, but I would love to have you back. We have a new class on psilocybin as a medicine, and we're working closely and have made friends with the researcher at University of Washington, Dr. Nathan Sackett, who's leading the research that our governor just signed off on for veterans with substance use disorder problems. And so he's going to be doing that research within the next 2 years. I know it's a long runway to get ready for that, but we'd love to have you back and talk some about psilocybin, because we know the stigma against that is dropping faster than cannabis in some ways.
Yeah.
Right.
Yeah.
So we'd love to have you back and really spend some time getting into that.
I would love that. Just tell me when. All
right. Hey, thank you very much for spending time with us tonight. Students, glad to have you on. Do pay attention. We are, if you're not following our social media links, a great way to stay in touch is to follow us on Facebook, where we'll always post events like this. On YouTube, we have dozens of hours of free content for great informative lectures and interviews like this one. So it's just a great place to get nerdy about weed, and we want to encourage you to get nerdy about this, and then light small fires. Encourage people to think about it, to consider it. CBD, cannabis is not a gateway drug, but CBD is a gateway drug to hearts and minds, because CBD won't get you high, and topicals also are a great introduction to the topic. To the subject. So thank you all for doing what you do. Nurse Hall, thank you for being back, and we really appreciate you. If you don't mind hanging back, I would love to ask you a couple questions. Yes. And you all have a great night. Thanks for being with us.
It's great to meet you.